listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, the first round of Medicare Part D negotiated drug prices is here. CMS announces Part D savings and 2026 maximum fair prices for the first 10 Medicare-negotiated drugs, written by Roxanne Anderson and Isabel Vitale. On August 15th, the Centers for Medicare and Medicaid Services, CMS, announced the negotiated 2026 Medicare drug prices for 10 common and expensive drugs used by beneficiaries. As a result of the negotiations, many individuals will see significant out-of-pocket savings. In 2023, CMS selected the first 10 drugs Medicare would negotiate the price of with manufacturers. According to the Medicare drug price negotiation timeline, conversations ended August 1st, 2024. The list, which we're about to get into, features the negotiated Medicare drug maximum fair prices for the first 10 drugs, all of which are among those with the highest total spending in Medicare Part D. When the prices take effect in 2026, beneficiaries will see hundreds to thousands of dollars in savings on 30-day supplies, totaling a collective estimated savings of $1.5 billion in out-of-pocket costs for the year. Price reductions for the first round of drugs in the Medicare drug price negotiation program span from 38% to 79%. Number 1 on the list, Eliquis, which is manufactured by Bristol Myers Squibb and used for the prevention and treatment of blood clots. In coverage year 2023, just over 3.9 billion Medicare beneficiaries used the drug. Back then, the list price for a 30-day supply was $521. The negotiated price brings the cost of a 30-day supply down to $231 for coverage year 2026. That comes out to a 56% decrease in price, or $290 in savings. Number 2, Enbrel from the Immunex Corporation. This drug is used to treat rheumatoid arthritis, psoriasis, and psoriatic arthritis. It was taken by 48,000 Medicare beneficiaries during coverage year 2023. Back then, a 30-day supply cost $7,106. In coverage year 2026, the negotiated price for a 30-day supply will cost $2,355. Medicare beneficiaries will see a 67% decrease on the list price of Enbrel. That works out to a savings of $4,751 in 2026 compared to 2023. Number 3, from Novartis Farms Corporation, Entresto, which is used to treat heart failure. 664,000 Medicare beneficiaries used the medication during coverage year 2023, with a list price of $628 for a 30-day supply. In 2026, the negotiated drug list price for a 30-day supply of Entresto will be $295. That represents savings of $333, a 53% drop in price. Number 4, Farxiga, which is manufactured by AstraZeneca AB. The drug is used to treat diabetes, heart failure, and chronic kidney disease. In coverage year 2023, 994,000 Medicare beneficiaries took the drug, which at the time had a list price of $556 for a 30-day supply. That cost will drop to $178.50 for Medicare beneficiaries during coverage year 2026. Beneficiaries will save $377.50 on Farxiga during coverage year 2026, a savings of 68%. Number 5 on our list, a handful of insulins used to treat diabetes, all produced by Novo Nordisk Incorporated. Fiasp, Fiasp FlexTouch, Fiasp PenFill, Novolog, Novolog FlexPen, and Novolog PenFill. In coverage year 2023, 785,000 Medicare beneficiaries used one of these drugs to treat their diabetes. The list price was $495 for a 30-day supply in coverage year 2023. For coverage year 2026, the list price will come down 76% to a cost of $119. That is a $376 savings. Number 6, from Pharmacyclics LLC, Imbruvica, which is used to treat blood cancers. 17,000 Medicare beneficiaries used Imbruvica during coverage year 2023. The list price for a 30-day supply of Imbruvica in coverage year 2023 for a Medicare beneficiary was $14,934. In coverage year 2026, the cost will drop to a negotiated list price of $9,390 for a 30-day supply. That represents 38% savings, or $5,615. Number 7, another diabetes medication, Januvia from Merck Sharp Dome. 843,000 Medicare beneficiaries used Januvia during coverage year 2023. During that year, the list price was $527 for a 30-day supply for Medicare beneficiaries. The price of Januvia will decrease by 79% for coverage year 2026, coming in at a negotiated price of $113. $414 is the savings Medicare beneficiaries will see on a 30-day supply of Januvia in 2026 when compared to the 2023 list price. Number 8, from Boehringer Ingelheim, Jardiance. This drug is used to treat both diabetes and heart failure, and during coverage year 2023, 1,883,000 Medicare beneficiaries used it. The list price for a 30-day supply back in 2023 was $573. In 2026, the list price of Jardiance will drop 66% to $197 for a 30-day supply, a savings of $376. Number 9 on the list, from Janssen Biotech Incorporated, Stelara. 23,000 Medicare beneficiaries took Stelara during coverage year 2023. It's used to treat psoriasis, psoriatic arthritis, Crohn's disease, and ulcerative colitis. In coverage year 2023, Stelara's list price was $13,836 for a 30-day supply. The negotiated list price for 2026 gives Medicare beneficiaries a savings of 66% on a 30-day supply, coming in at $4,695. That represents a savings of over $9,000 on Stelara. Number 10, Xarelto from Janssen Pharmaceuticals, which is used for the prevention and treatment of blood clots, as well as the reduction of risk for patients with coronary or peripheral artery disease. In coverage year 2023, 1,324,000 Medicare beneficiaries used the drug. Back then, the list price was $517 for a 30-day supply. In 2026, Medicare beneficiaries will pay a negotiated list price of $197, saving $320 on a 30-day supply. That comes out to a 62% savings on Xarelto. Now, a couple other important things to mention about these drugs. As long as a drug remains in the Medicare Drug Price Negotiation Program, a discount will apply. Each year the drug remains in the program following their initial year, CMS will adjust the price by the annual percentage increase in the Consumer Price Index for all urban consumers.
The price may also include any other updates based on renegotiations between CMS and the drug manufacturer. As we moved through the list, we mentioned quite a few drug manufacturers, and you might be wondering, must all manufacturers participate in the Medicare Drug Price Negotiation Program? No, manufacturers were not required to participate in the CMS Drug Price Negotiation Program. Drug manufacturer participation in the program was voluntary. Participating drug companies are required to ensure the negotiated prices of the selected drugs are made available to beneficiaries and all entities like pharmacies and mail order services and other entities that dispense the drug to such individuals. And if you're wondering about the future of Medicare drug price negotiations, the Inflation Reduction Act of 2022 gave CMS the power to negotiate pricing on some of the highest spending drugs to make prescriptions more affordable for Medicare beneficiaries. The lower prices on this first list of 10 drugs is just the start. In 2025, Medicare will negotiate the prices of up to 15 more Part D drugs for coverage year 2027. In 2026, they'll negotiate the prices of up to an additional 15 Part B or D drugs for coverage year 2028. And then they'll negotiate up to an additional 20 Part B or D drugs each year thereafter. So far, in addition to this first list of 10 negotiated drugs, CMS published their draft guidance on 2027 Medicare drug price negotiations in May 2024. We'll be linking to that document in the episode notes. These additional negotiations are expected to lead to even more out-of-pocket savings for Part D beneficiaries in years to come. Stay tuned to our podcast for updates on drug price negotiations, as well as other important industry news. You can do that in the app you're listening on right now. Thanks so much for following along with us, and thank you for listening to this episode of the Agent Survival Guide podcast. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written by Roxanne Anderson and Isabel Vitale. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Rate and review our show on Apple or Spotify.